Hi, my name is Dr. Jayesh Panchal and I'm a plastic surgeon here in Edmond, Oklahoma. And I'm going to tell you a little bit about breast augmentation. As a matter of fact, breast augmentation is one of the commonest surgeries performed in this country and across the world. Who is the best candidate for a breast augmentation? Not everyone is blessed with perfect breasts, and a breast augmentation helps to achieve that goal in life. It is not unusual for women who have lost weight, who have had children, 25 years, 10 years later, start noticing that the volume of the breast is lost and will require correction of the sagging of the breast, and at the same time need an implant. Generally we use nowadays a breast augmentation implant that is made up of silicone. This has been approved by the FDA since 2006. The implants are safe, and if there is a tear, the gel does not come out to form lumps in the breast. This is a great advance since 2006. These silicone implants are covered throughout the life of the patient, and the manufacturer will give you a free implant throughout your life, and at the same time they will give you additional dollars to undergo surgery in case there's detection of a tear in the implant on MRI. Over time, silicone breast implants have come up to be very safe to use. One of the biggest problems that patients face when they come to see me, and the question that bothers them most, is what size is the right size for me? The best way to answer that question is not by saying that it is a this cc or that cc or this cup or that cup. I think the first step is to try and understand what the patient's needs and desires are. I begin that by asking, what is your occupation? What job do you do? What are your hobbies? Do you do a lot of CrossFit, a lot of weightlifting? Do you run a lot? And based upon that, I will come to know what size would be one of the best sizes for them. However, breast size change of the implants is one of the commonest reasons why people undergo surgery for a second time or revision surgery. To prevent that from happening, I think the best way is to use 3D software to give the patient an idea how their breasts are going to look on the day of the consult while they're still going to undergo surgery in the future. We do that by utilizing an iPad and creating a 3D image. We will then insert a breast implant within the 3D image, and then once you've done that, I will give the patient a 3D virtual reality glasses, and they can see their future breasts in 3 dimensions. They will know how they're going to look after the surgery right there on their first consult. This is a very accurate method of finding out what will give the highest satisfaction for a breast augmentation procedure. The surgery is typically performed at a surgery center and lasts approximately an hour or so, requires a short general anesthesia, and the incision is placed under the breast. This gives us direct access to where the implant needs to be placed. The surgery involves placing the implant typically behind the muscle. Although implants can be placed above the muscle, there is a problem with that. Implants placed above the muscle will definitely show ripples and have a higher chance of becoming hard or firm over time. Multiple clinical studies over time have shown that if you put the implant behind the muscle, then the risk of having a capsule contraction is significantly reduced, plus the chances of seeing ripples or wrinkles in your implant is dramatically reduced. Recovery typically is lasting for approximately 3 days or so. Most people feel very comfortable, generally not a painful procedure, and approximately after 3 to 5 days can easily return back to their work. As far as exercise is concerned, I have a little discussion in the post-operative period how they're going to manage the exercise protocol depending on what they do. My job as a surgeon is not only to make my patients happy, but to listen to everything that they wish to have and make their desire a success every time. Thank you very much for listening.